Welcome today. My name is Dr. Clarissa Beiting, and I'm with Lexington Clinic Gynecology. This is Kim Martinez, my nurse, and we're going to talk today some pre-op consideration. If you're considering scheduling for surgery, some things to keep in mind while we're scheduling and just in planning for pre-op as well. First, what we'll talk about is in the planning stages, things we need to know for your gynecologic surgery are what prior surgeries you may have had. So that's super important for me, particularly as I plan the route of surgery, whether we do something abdominally or vaginally, what to expect as far as previous incisions, whether there be any previous hernia surgeries. All those are considered important history of prior surgery. So just let me know all those as you can remember. The next would be your medical history. So Kim, what kind of medical issues are super important in planning for the gynecologic surgery?
Yes, we need to know any significant medical history that you may have had, such as any cardiac history, hypertension. If you're having any current symptoms or you do have a cardiologist, please let us know. Likely, if you do have any cardiac history, if you are seeing a cardiologist, have seen one in the past, we may ask you to see this cardiologist again and get something called a cardiac clearance.
Yes, the cardiac clearance is typically recommended by the anesthesiologist. And of course, the anesthesiologist would appreciate just having known that you're up to date with all your cardiac screening. Plus, your cardiologist may want to do a specific test like an EKG or echo before surgery just to make sure that you're ready to go and should have a healthy outcome with your surgery.
If you're currently having any cardiac symptoms, such as lightheadedness, fatigue, going up the stairs and experiencing anything like this with exertion, please let us know. Dr. Beiting can make a referral to cardiology for you if you don't currently have one.
Yeah, so Lexington Clinic, we do have some cardiologists, so we could get you in to get your heart evaluated before surgery. So what are some medications that we need to specifically know about in the pre-op period?
It's very important that we do have your full medication list on your chart, meaning as well anything over the counter. A lot of people kind of forget about this when they come in and let us know what medications they're currently taking. We need to know any over-the-counter medications, herbal supplements. Herbal supplements can potentially interact with anesthesia, so we may ask you to hold them, such as fish oil. That's a very common one that patients take, and we do ask that you hold that for 7 days prior to your procedure. Another very important medication is blood thinners. Right, Dr. Beiting?
Yes, I think patients who may be on Eliquis, maybe any of the different brands, Plavix, even an aspirin a day. So the more important, of course, are the Coumadin, Plavix, Eliquis type medications. Those need to be discontinued prior to surgery, but you need to make sure that you do that and clear that with the prescribing physician. So whether it be your cardiologist or primary care physician, and that they need to be in contact with us so that we can know that can safely be discontinued. Some patients aren't allowed to come off their blood thinners, may need to be bridged with a heparin treatment. So there are some options for some patients who cannot come off blood thinners, but we do need some special care associated with those patients who are on blood thinners. Some patients are on aspirin a day, either just for preventative reasons, and their primary care physician probably will not have much trouble with you discontinuing that. So typically, if the benefits outweigh the risk, we'll have you go ahead and stop the aspirin for about 7 days prior to the surgery. What about the weight loss medications?
Yes, please let us know if you are taking any form of weight loss medication. There are oral forms, injectables. These are super important. They can cause complications with anesthesia.
Right.
So if you are on any of those medications, please let us know. Certain medications require that they be stopped for a certain amount of time, and we need to know exactly which one you're on, and we can let you know.
Right. So especially the weight loss injectables, those need to be discontinued typically a couple of weeks before surgery just to allow the normal bowel function. But of course, we'll need to work with your primary care physician as to whether or not you need it for glucose control or things like that. If you're just using it for weight loss, typically you're able to discontinue that without any problem. Phentermine is also another medication you got to be careful with anesthesia. They want you to discontinue that at least, I think it's a week or two before. So just make sure you let us know about any weight loss medications that you're on. What about patients with chronic constipation?
Yes, that is a very important subject. So please let us know if chronic constipation is a daily issue for you. We will advise to do like a bowel prep.
A bowel
before
prep,
surgery.
yeah. Usually patients do better, they heal better, they feel a little better in post-op if they don't have a bunch of constipation before surgery. So again, you don't have to do a full colon cleanse like you would have to do for a colonoscopy or some kind of imaging procedure up in the bowel. But sometimes it helps to use a little magnesium preparation preoperatively just to help with some of the buildup that might be in there. And it helps with comfort post-op.
Absolutely.
So what about preparing like food, drink before surgery?
So we ask the night before, up to midnight, you can eat your normal diet, but after midnight, the night before your surgery, nothing to eat or drink. The morning of, you can brush your teeth. Please let us know if there's certain medications that you do take in the morning. You can discuss that with Dr. Beiting, especially medication for your heart rate, like a beta blocker, hypertension.
Yeah, that's important. You do want to continue on all of your blood pressure medications and heart rate control. So beta blockers are real important to keep taking. And so we will ask you to continue those preoperatively on that. So some patients, if you're having a later surgery, there are some situations where you're able to have clear liquids up to 2 hours before arrival. Please notify me if you feel like your surgery is later and you feel like you would have a hard time being NPO prior to that arrival time. And we can set up a plan for that as well that anesthesiologists are okay with as well.
So another preparation for surgery is having a driver. This is very important. This is a common thing, Dr. Beiting, that we get a lot of phone calls about. Maybe someone does not have another person that is able to bring them, but we do have to have a person to bring you that is a family member or a close friend. It can't be one of those services like Lyft or Uber. The driver needs to bring you to the facility, be there with you, and able to drive you home. And also the night of your surgery, we don't want you alone.
Yes, at night after surgery, anesthesiologists do recommend having somebody around just for in case there is any kind of anesthetic reaction. So if you can have a family member or someone trusted friend that could stay all night with you, just to make sure there's no reactions or you're not having any surgical complications or someone to help you call if needed. So yeah, and the driver, again, no ride shares, as Kim said, that's super important. We want you home safely after your procedure.
Absolutely. And as you mentioned, anesthetic reaction, please let us know if there is any history of complications with anesthesia. Yes. If you have had anesthesia before, you've been slow to wake, or any complications at all, especially family history of complications. If you're aware of any family history of complications with anesthesia, please let us know.
Yeah, malignant hypothermia is one of those that can be a genetic disorder and life-threatening. So if you know of anybody in your family, please notify us as we will take special precautions.
Absolutely.
Well, we thank you for your time, and we look forward to taking great care of you.